Tricyclic antidepressants, or TCAs, are a class of antidepressant medications that share a similar chemical structure and biological effect. Scientists believe that patients with depression may have an imbalance in neurotransmitters, which are chemicals that nerves make and use to communicate with other nerves. TCAs were first discovered in the early 1950s and were later marketed in the decade. They are named after their chemical structure, which contains three rings of atoms. Cyclic antidepressants ease depression by impacting chemical messengers or neurotransmitters used to communicate between brain cells. These drugs work by affecting changes in brain chemistry and communication in brain nerve cell circuitry, known to regulate mood and to help relieve depression. TCAs work to counteract the effects of neurotransmitter deficiencies in three ways. They inhibit the effect of MAO, they block the reuptake function of the synaptic cleft, and they regulate receptor sites and breakdown of neurotransmitters. TCAs are mainly used to treat depression, but they also are used to treat mood disorders, relieve chronic nerve pain, reduce bedwetting, manage OCD behaviors, and prevent migraines. Like all drugs, these drugs come with many different side effects and vary depending on which independent drug you take. The nursing implications for TCAs are listed here. The main drugs we will be focusing on in this video are Elavil, Ascendin, and Trophanil.
Elavil's main indication is to treat depression, but its unlabeled uses include anxiety, insomnia, treatment-resistant depression, and chronic pain. Elavil potentiates the effect of serotonin and norepinephrine on the CNS and has significant anticholinergic properties. Initial assessment should include a fasting glucose and cholesterol levels in overweight and obese individuals. A baseline blood pressure and pulse before and during therapy should also be included. Notify a healthcare professional if there is a decrease in blood pressure or a sudden increase in your pulse. Those on high doses or with a history of cardiovascular disease should have ECGs monitored before and periodically during therapy. Side effects include suicidal thoughts, lethargy, sedation, blurred vision, dry eyes, dry mouth, arrhythmias, hypotension, constipation, increased appetite, weight gain, urinary retention, decreased libido, photosensitivity, and changes in blood glucose. Caution patient to avoid driving and other activities requiring alertness until response to drug is known. Alcohol or other CNS depressant drugs during and for 3 to 7 days after therapy has been discontinued. Caution patient to use sunscreen and protective clothing to prevent photosensitivity reactions. Alert patient that medication may turn urine blue or green in color, and medication should be discontinued as long as possible before surgery. Orthostatic hypotension, sedation, and confusion are common during early therapy, especially in geriatric patients, and advise patient, family, and caregivers to look for suicidality, especially during early therapy or dose changes.
Amoxapine, or Ascendin, is classified as a therapeutic antidepressant. Ascendin is used to treat a variety of different types of depression, but is also found helpful in treating anxiety, insomnia, neuropathic, and chronic pain disorders. The action for Ascendin is that it potentiates the effects of serotonin and norepinephrine in the central nervous system. Ascendin has significant anticholinergic properties, also has anti-anxiety effect related to sedative properties. For therapeutic effects, it acts as an antidepressant and anti-anxiety action. Ascendin should not be used in patients with angle closure glaucoma or have a history of heart-related problems, such as recent heart attack, cardiac arrhythmia, or heart failure. Ascendin has contraindications with people who have pre-existing cardiovascular disease, prostatic hyperplasia, history of seizures. In the initiation phase of therapy with Ascendin, children and adolescents may be at greater risk for suicide. In geriatric patients, they are more susceptible to the adverse effects of Ascendin, and dosage reduction may be required. Adverse reactions to Ascendin include fatigue, sedation, hypotension, blurred vision, dry eyes, dry mouth, and constipation. Nursing implications that should be included with Ascendin are monitoring the patient for mental health status and frequently checking suicidal tendencies, especially during the beginning stages of therapy. you should restrict the amount of drug available to the patient. Also, another implication should be that the nurse should monitor blood pressure and pulse before and during the initial therapy. The physician should be notified if there are any adverse reactions going on at the beginning stages of the therapy. If more serious side effects present themselves with Ascendin, such as the slowing of heart rate or respiration rate, you may want to take your child to a primary health care provider.
Imipramine or tofranil is used to treat depression and childhood enuresis. It can also be used to treat headaches, insomnia, incontinence, and chronic pain. This drug potentiates the effect of serotonin and norepinephrine. It also has significant anticholinergic properties. The antidepressant actions develop slowly after a few weeks of being on the medication. Patients taking tofranil should be titrated from a low dose to a higher dose, and patients should be on lower doses in general as an outpatient rather than on an inpatient basis because they can't be actively monitored. Side effects of tofranil include an increased risk for suicide, drowsiness, fatigue, agitation, confusion, hallucinations, insomnia, blurred vision, dry eyes, arrhythmias, mouth dryness and nausea, weight gain, urinary retention, decreased libido, and photosensitivity. Nursing considerations should be to monitor the patient's blood pressure and pulse before and during therapy. The patient should be weighed and their BMI should be recorded and monitored. Patients' mental status and suicidal tendencies should also be assessed frequently. Patients should be advised to take medication properly and that abrupt discontinuation may cause changes in mental status, nausea, vomiting, insomnia, and other complications.
Nursing implications that come with Ascendin should include the monitoring of mental health.
When teaching the patient's family about adverse